Chapter 4: Preventing Infections While Providing Personal Care. Residents in long-term care facilities are at risk of exposure to bacteria that have become resistant to antibiotics. Unfortunately, people die every day from these serious bacterial infections. Residents who are elderly, frail, or already weakened by another illness are most at risk for contracting some type of infection. Many of these infections can be prevented. The challenge is to provide personal care in a way that protects both the residents and staff. Infections spread because of careless infection control practices. Adherence to established protocols while caring for the resident can often prevent these tragedies. You have a very important role in preventing and controlling infections in your facility. In this chapter, you will learn how microorganisms are transmitted and what you can do to prevent the spread of infection. You will learn how to incorporate infection control practices into the personal care routines you will use every day. What are microorganisms and how do they cause infection? Microorganisms are so small they can be seen only with a microscope. They are usually single cells or infectious particles and include bacteria, viruses, fungi, and parasites. The commonly used term for these microorganisms is germs. Many microorganisms live naturally on the skin. They also live in the intestines, vagina, mouth, and other parts of the body. These bacteria are called natural flora. In a healthy person, these bacteria are in balance and do not cause problems. However, if the natural balance is disrupted due to illness, poor nutrition, stress, fatigue, or certain drugs, these microorganisms may cause infection. Microorganisms that live in one part of the body without causing problems can cause serious infection if they reach another part. For example, Escherichia coli bacteria, abbreviated as E. coli, normally live in the gastrointestinal tract. If these bacteria reach the bladder, they can cause a urinary tract infection. You may have heard of E. coli infections reported in the news related to food contamination caused by improper food handling or contaminated water or food products such as meat and produce. The chain of infection. Organisms are transmitted from one organism, person, or animal to another in a process called the chain of infection. 6 elements or conditions must be present for the infection to be transmitted. 1. The microorganism is capable of causing an infectious disease. 2. The microorganism resides in a reservoir, person, animal, or environment. 3. It leaves the reservoir via a portal of exit, route of transmission. 4. It travels via a mode of transmission, the means by which it is transferred. 5. It reaches a portal of entry, the place where it enters the second organism. 6. It enters a susceptible host, the person or animal who is at risk of developing an infection from the microorganism. The microorganism. The first link in the chain is the microorganism that causes the infection. Many types of viruses, bacteria, and fungi cause infections. Microorganisms that cause pathogens. Those that do not are called non-pathogenic. Without a pathogenic organism, there can be no infection. The reservoir. The second link is the reservoir. This is where the microorganisms live. The human body is a reservoir for many different types of microorganisms. They also live in animals, plants, soil, food, and water, as well as on surfaces in the environment. Portal of exit. The portal of exit is the route by which the microorganism leaves the reservoir. Microorganisms must exit from an infected person or another reservoir to be transmitted to another person. Portals of exit include all natural body openings and breaks in the skin, such as tears or wounds. They also include openings made during medical, dental, and surgical procedures. For example, microorganisms in the lungs can exit the body when a person coughs or sneezes. Microorganisms in the bladder exit in urine, and those in the intestinal tract exit in stool. Modes of transmission. Organisms are transmitted from the portal of exit of one person to the portal of entry of a susceptible person. This can happen in several ways or modes, including direct and indirect and airborne transmission. Direct transmission of microorganisms from one person to another can occur via physical contact, such as kissing, skin-to-skin contact, and sexual intercourse. Direct transmission also occurs through droplet spread. This occurs when a direct spray of mucus from coughing, sneezing, or talking comes in contact with another person's eyes, nose, or mouth when people are within 3 feet of each other. Droplet-transmitted diseases such as chickenpox and measles spread quickly among children. Direct transmission also occurs when one person's infected blood or other body fluids come in contact with another person's broken skin or mucous membranes. Indirect transmission occurs when a microorganism is transferred from one person to another via a vehicle, some type of inanimate object, or a vector, living agent that transmits infection, such as a tick or mosquito. Infectious organisms may be transmitted via soiled linen or dressings and contaminated surfaces, water, and food. Airborne transmission occurs when microorganisms are carried in aerosols, tiny particles suspended in air, and a susceptible host inhales the particles. The bacteria that cause tuberculosis, TB, are transmitted in this way. TB microorganisms air, but airborne transmission can be prevented if the facility has proper ventilation and air exchange systems. The measles virus can also be spread this way. It can live up to 2 hours suspended in air. Portal of entry into host. Most often the portal of entry is a natural opening in the body. For example, a susceptible host may breathe in microorganisms through the nose and mouth when a nearby person coughs or sneezes. The portal of entry may also be an open wound. This includes skin tears and pressure ulcers. Microorganisms that cause diarrhea can enter a susceptible host's digestive system when a person preparing or handling food did not wash their hands after using the bathroom. Bacteria and viruses that cause sexually transmitted disease can enter through the mouth, vagina, penis, or anus. Susceptible host. We are all susceptible to infections caused by viruses, bacteria, fungi, and other pathogens. A resident can become more susceptible to infection due to existing diseases or health conditions. For example, a person with respiratory disease may be more susceptible to inhaled pathogens. Other reasons for increased risk of infection include treatment with steroids or chemotherapeutic agents that weaken the immune system, breaks in the skin, use of invasive devices such as catheters, an unclean environment, or simply advanced age. Strategies for breaking the chain of infection. If even one link in the chain of infection is broken, disease cannot be transmitted. Many different infection prevention and control measures can be used to break the various links in standard precautions. Standard precautions are evidence-based practices designed to prevent the transmission of infectious disease. According to the Centers for Disease Control and Prevention, CDC, standard precautions represent the minimum infection prevention measures that apply to all patient care, regardless of the status of the patient in any healthcare setting. The goal of standard precautions is to reduce the risk of transmission of microorganisms from both recognized and unrecognized sources. This means that you use the same precautions around someone you think is healthy as you would use around someone who is known to have a virus or other infectious disease. You should assume that all blood, body fluids, wounds, and mucous membranes may be infected. Standard precautions include many work practices that minimize or eliminate your exposure to pathogens. Key elements are proper hand hygiene, proper use of gloves, gowns, and facial protection, proper handling of linens, proper environmental cleaning and waste disposal, proper use and disposal of patient care equipment, prevention of needle sticks and injuries from other sharp instruments, respiratory hygiene and cough etiquette. Hand washing. Every facility has readily accessible hand washing areas. Standard precautions require that you wash your hands with soap and warm running water immediately before and after all care procedures. Proper hand washing is essential to making sure that the skin is free of contamination by potentially infectious microorganisms. When soap and water are not available, an alcohol-based hand cleanser can be used, and you must rub your hands thoroughly until they are dry. Your facility will have guidelines in place for when an antimicrobial agent or a waterless antiseptic agent should be used. Recent studies have shown that more bacteria are present under long fingernails. The Center for Disease Control and Prevention, CDC, recommends that nails should be no longer than 1/4 of an inch. Acrylic and silk nails harbor bacteria and should not be worn in a healthcare setting. It is also recommended to wear as little jewelry as possible, since rings and bracelets can also become contaminated with microorganisms. There are certain situations in which hand washing must be done. You must wash your hands before and after each shift, before and after every resident contact, between care activities, after helping the resident toilet and before helping with the bath, after using the bathroom, before and after handling food, after handling anything you think could be contaminated, dirty, after contact with blood or body fluids, before and after cleaning an area, before and after handling body fluids collected for testing, before putting on gloves, after removing gloves, after a cough, sneeze, or blowing your nose. Wash your hands before putting on gloves and immediately after removing gloves or other personal protective equipment. If you come in contact with blood or other potentially infectious materials, immediately wash your hands and the affected skin areas with soap and water. If your mucous membranes, such as your eyes or inside your nose or mouth, are splashed with blood or fluid, flush the area with water immediately. Such contact may occur from the splattering of fluid, such as when emptying a urinary drainage bag or rinsing a bedpan. Gloves and other personal protective equipment. Barriers include gloves, gowns or plastic aprons, masks, and eye protection. Various types of barriers are used along with hand washing to prevent the spread of infection. Barriers protect your hands, skin, clothing, eyes, and mucous membranes from microorganisms. They also protect residents from microorganisms that may be on your hands, skin, or clothing. Standard precautions require that gloves be worn in the following situations: when touching blood, body fluids, secretions, excretions, or contaminated items, when touching mucous membranes or broken, non-intact skin. Most often you will need single-use disposable gloves. Gloves are made from different materials. Most are made of latex, but non-latex gloves are available for people who are allergic to latex. These gloves are packaged as clean, not sterile. Some types of gloves fit better than others. Your facility will have various sizes of gloves on hand. Good-fitting gloves are needed for fine motor skills. Most of the time, you do not need sterile gloves or tight-fitting gloves. Gloves must be changed between tasks, before giving care to another resident, and before touching non-contaminated items and environmental surfaces. Change your gloves and wash your hands before caring for each resident and anytime the gloves become visibly contaminated. You must wash your hands after removing gloves because they may become contaminated from small defects from tears in the gloves that occurred during use or when removing the gloves. You must also change your gloves when moving from a contaminated body site to a clean one. The correct steps for putting on and removing gloves are shown in Procedure 4.2. When you clean equipment or surfaces like a bedside table, you should wear heavy utility gloves rather than single-use disposable gloves. The chemicals in cleaning solutions can irritate your hands, and heavy utility gloves can offer better protection. You can reuse utility gloves unless they are cracked, torn, or worn out, just as you reuse similar gloves. Gowns. Gowns are made of cloth, paper, or plastic. A clean, non-sterile gown should be worn to protect your skin and prevent soiling of your clothing when you perform tasks that may splash or spray you with blood, body fluids, secretions, or excretions. Wear a gown when a resident has diarrhea, is vomiting, or has large amounts of drainage from a wound. A soiled gown should be removed as soon as possible after completing your task. If you are using gloves and a gown, put the gown on first, then the gloves. Remove the gown after completing your task with the resident. The correct steps are shown in Procedure 4-3. Plastic aprons are barriers that cover the front of your clothing. They are particularly useful in situations in which your clothing may get wet, such as when you are helping a resident to bathe. Plastic aprons are also useful when changing soiled linen that cannot easily be folded in on itself to contain the soiled area. Disposable plastic aprons usually have a neck strap and ties at the waist. They do not protect your arms. When you need to wear gloves and a plastic apron, put the apron on first, then the gloves. Remove the gloves first, then the apron. Be sure to wash your hands after removing the apron. Face protection. Surgical or procedure masks, visors, goggles, and face shields are used to protect the mucous membranes of your eyes, nose, and mouth during tasks that are likely to involve splashes or sprays of blood, body fluids, secretions, or excretions. For example, face protection is used when using a Foley catheter drainage bag or assisting a nurse with suctioning a resident. Masks. Masks are an effective barrier to splashes or splatters. They also protect against inhaling droplets in the air. The mask must fit tightly so that you do not inhale air around the sides of the mask. If you will be spending a long time with a resident with an infectious disease, change your mask every 20 minutes, sooner if it becomes moist. Very few situations in long-term care facilities require wearing a mask to protect residents from you, but you do need to wear a mask to protect residents from droplets if you have a cold with a cough. Although there are different kinds of masks, all have a metal bar on the bridge of the nose and ties, straps, or elastic to secure the mask. If you need to wear a mask, gloves, and a gown or apron, put the gown or apron on first. Then put on the mask and put the gloves on last. Remove the gloves first, then the gown or apron, and then the mask. Wash your hands after you have removed all these barriers. The correct steps are shown in Procedure 4-4. Eye protection. Goggles and glasses with side shields protect the eyes from splashes and splatters. You will rarely be in a situation that requires eye protection, but you must know how to use it. If you wear eyeglasses that you want to use for splash protection, they must have side shields, which are add-on devices. The infection control practitioner in your facility can help you locate the correct side shields for your glasses. If you do not wear glasses and need eye protection, you can use goggles or a face shield. Goggles can be washed, dried, and reused, as can most face shields. Some manufacturers make a single-use combination mask and eye protection shield. These shields can be worn over corrective glasses and protect against any splashes from the front and sides. If you are using eye protection and a mask along with a gown or plastic apron and gloves, put on the option when you put on the mask. Remove it when you remove the mask. As always, wash your hands after you remove all barriers. Linens. Used linens must be handled and transported in a way that prevents exposure to pathogens. Linens that are soiled with blood, body fluids, secretions, or excretions must be handled in a way that prevents exposure of your skin and mucous membranes or contamination of your clothing. At a minimum, wear gloves. Always carry linens by holding them away from your uniform, even if not visibly soiled. If the linens are wet, you should also wear a gown. Environmental cleaning and waste management. You will need to learn your facility's procedures for the routine care, cleaning, and disinfecting of environmental surfaces, beds, bed rails, bedside equipment, and other frequently touched surfaces. Waste that requires special handling. A number of terms are used to designate waste that require special handling. These include biohazardous waste, regulated waste, infectious or infective waste, and special waste. All states have regulations regarding the handling and disposal of waste material that is contaminated with blood or secretions and excretions. Waste regulations vary from state to state and from city to city. Your infection control practitioner will inform you about your facility's procedures for waste handling and disposal. Equipment used for resident care. Equipment used as part of daily resident care must be handled and transported in a way that prevents the spread of microorganisms. Equipment that has been soiled with blood, body fluids, secretions, or excretions must be handled so that contact with your skin and mucous membranes or contamination of your clothing does not occur. At a minimum, wear gloves and a gown. You must ensure that reusable equipment is not used for the care of another resident until it has been properly cleaned and disinfected, and that disposable, single-use items are disposed of according to local and facility waste management guidelines. If a resident frequently contaminates the environment or does not help maintain appropriate hygiene or environmental cleanliness, you should discuss this with the charge nurse. Alternate rooms or additional precautions may be needed. Preventing transmission of bloodborne pathogens. Needles or other sharp objects, such as razors, can spread infection if not handled or disposed of properly. An injury may occur when handling sharp instruments after procedures, when cleaning used instruments, or when disposing of used needles. The following guidelines will help protect you and your residents. Never recap, put a cap back on used needles. Use needles with attached safety devices. Place used disposable syringe and needles and other sharp items in designated puncture-resistant sharps containers. Breaking the chain at the reservoir link. Some microorganisms, such as certain bacteria, are susceptible of the effects of antibiotics, which may be used as treatment for these infections. This treatment reduces the number of microorganisms and the severity of the infection, allowing the person to get well so he or she is no longer a reservoir. Proper food handling practices prevent food from becoming a reservoir for microorganisms. This includes using clean equipment for preparation, adequate refrigeration for storage, and proper hand washing, especially after using the bathroom, coughing, or sneezing. If food sanitation is not maintained, many people can become ill from eating contaminated food. Breaking the chain at the mode of transmission link. Diseases such as gonorrhea, syphilis, and human immunodeficiency virus (HIV) are transmitted by direct contact during sexual activity. HIV can also be transmitted through direct contact with the blood of an infected person. There are no vaccines for these diseases. Using condoms during sex is one way to prevent the spread of sexually transmitted diseases. The herpes simplex virus is also transmitted by direct contact. One strain of this virus causes fever blisters and cold sores, and a second type causes genital herpes. You must wear gloves when giving mouth care. A mouth care sponge with a handle can be used to avoid touching the affected area. Airborne transmission can be reduced when the facility has appropriate ventilation and air exchange. Staff members also need to recognize when a resident's cough is a symptom of infection and to report this and other symptoms to the nurse. Recognizing and treating airborne diseases such as measles and tuberculosis at an early stage helps to prevent further transmission. Breaking the chain at the susceptible host link. People develop immunity to some microorganisms after one infection, but many types of pathogens can cause repeated infections. Breaking the chain at the susceptible host link depends on the microorganism and the individuals. If a vaccine is available, the best way to protect susceptible hosts is to vaccinate them. Immunization against certain diseases can keep you and residents from being susceptible hosts. Annual flu shots should be given to residents and staff if not contradicted. CMS currently recommends that all eligible residents be offered an influenza every year and a pneumococcal immunization every 5 years. The best way to protect residents from becoming sick from microorganisms that are already in their bodies is to help them maintain their nutritional status and mobility. You can protect yourself from infectious diseases by keeping up with the recommended immunization schedule, staying as healthy as you can, and following established infection control procedures, especially in regards to frequent and thorough hand washing. Table 4-2 provides an overview of the most common types of infections seen among residents in long-term care facilities. To prevent the spread of these diseases, you must never let infection control activities become routine. Ask yourself these questions if you suspect an infection is present. Who or what may be infected? The source of infection may be a resident, staff member, visitor, or something in the environment such as equipment in the resident's room or a food source. Who is at risk? A resident may become more susceptible to infection due to advanced age or underlying disease. Risk is also increased by treatments with steroids or chemotherapeutic agents, breaks in the skin, and use of invasive devices such as urinary catheters, intravenous catheters, and G-tubes. How can the microorganism be transmitted? Microorganisms can be transmitted through all routes. The most common routes in the facility are direct and indirect contact, droplet, and airborne transmission. What do I need to do to protect residents and myself? Use protective equipment, wash your hands between residents and procedures, and change your gloves often. Change gloves between residents and whenever they are contaminated. Promote good nutrition and exercise. Encourage annual influenza and pneumococcal vaccinations. Treatment-resistant microorganisms. Healthcare-associated infections, HIAs, are infections contracted while receiving care in some type of inpatient, outpatient, or residential facility. Antibiotic-resistant microorganisms are among the most serious threats in any healthcare facility. Resistant microorganisms cause infections that cannot be managed with usual forms of treatment, and these infections are very serious, especially in older adults and those with compromised immune function. The most common threats to long-term care residents include Clostridium difficile, C. diff. These bacteria cause diarrhea in patients after antibiotic use. It is classified by the Centers for Disease Control and Prevention, the CDC, as a severe threat due to the number of people who are affected and the severity of the symptoms. Methicillin-resistant Staphylococcus aureus, MRSA. These bacteria cause a range of illnesses from skin and wound infections to pneumonia and potentially fatal blood infections that can cause sepsis. Vancomycin-resistant Enterococcus, VRE. These bacteria cause a range of illnesses, including surgical site infections and infections of the blood and urinary tract. Antibiotic-resistant infections are hard to treat and can be fatal. As a nurse assistant, you must make sure that you follow all isolation and infection control policies within your facility. The CDC issues guidelines for long-term care facilities to prevent and control the spread of each type of treatment-resistant infection. Isolation precautions. Isolation precautions are the actions that facilities take to keep microorganisms from spreading from one resident to others. Specific practices are usually described in the facility's infection control manual or isolation manual. You should be familiar with the isolation precautions used in your facility. The infection control practitioner will teach you how to implement the steps involved in isolation precautions. Talk to the charge nurse if you have any questions about your duties in regard to these precautions. The CDC has specific recommendations for isolation precautions. In addition to the standard precautions previously described, the CDC recommends using transmission-based precautions for residents who are known or suspected to be infected with highly transmissible pathogens. Cleaning, disinfection, and sterilization. To practice infection control, you must understand the concept of clean versus dirty. If something is considered clean, it remains clean until it is contaminated with something considered dirty. For example, if you wash your hands properly before preparing supplies for a resident, your hands are considered clean. But if you answer a phone call, open the door for someone, or blow your nose, your hands are now considered dirty until you wash them again. The safest approach is to assume that everything is dirty and needs to be cleaned. This includes objects such as tables, trays, glasses and dishware, personal care items, and your hands. Keep the concept of clean versus dirty in mind at all times. This awareness will help decrease the spread of germs that could be harmful to you and to residents. Cleaning. Cleaning is the removal of soil from objects. Water, detergent, and scrubbing are used to clean things. Cleaning helps control and prevent infection and keeps the environment pleasant and free of odors, dust, and dirt. The facility's housekeepers regularly clean floors, carpets, walls, and large items. They also clean drapes, curtain dividers, and furniture as needed. When a resident is discharged, housekeepers should thoroughly clean the bed, chairs, overbed and bedside tables, and the entire room so the environment is clean and ready for the next resident. In some facilities, nurse assistants clean the resident's immediate environment during daily care activities. Be sure to know which staff member is responsible for cleaning furniture and smaller items in the residents' rooms and understand your area of responsibility. Providing personal care. Your role in preventing and controlling infection is very important. Now that you understand how microorganisms cause infection, you can apply this knowledge as you learn how to incorporate infection control practices into everyday care routines for your residents. Personal care includes bathing, grooming, and dressing. How much help you give a resident depends on each individual's needs. When you help a resident with personal care, remember that you are assisting them with tasks they previously did on their own, in private, with no help. This includes their bathing and toileting routines. Receiving your assistance may be difficult or embarrassing for some people. You must treat each resident with respect and dignity as you provide individualized care. Keep in mind that most people care how they look, and everyone has their own style and preferences. Helping residents keep up their grooming and appearance can help them feel better about themselves and improve their quality of life. Residents' personal preferences. In long-term care facilities, the term routine care is often used to refer to daily care activities. Keep in mind that the word routine does not mean that you do not pay attention to each resident or that all residents' needs are the same. Before you assist with personal care, you need to take the time to learn each person's likes and dislikes. Residents have specific ideas about cleanliness, grooming, and dressing. Always base the care you give on each resident's personal preference. If a resident cannot express their preferences, ask family and friends for their input. During all personal care activities, encourage the resident to participate as much as possible and explain each step as you go. Observation and determination of assistance needs. In this chapter, you will learn how to perform the tasks involved in personal care, but remember that your job involves much more than this. Before you take any action, you need to observe the resident and determine his or her capabilities related to each task. This requires that you analyze the situation to see how best to help the resident. By first determining the resident's needs, you will be better prepared and more organized. Residents also will find the experience more pleasant and will appreciate your attention. Observation is very important when helping with personal care. Your job is to observe residents for any physical or psychological changes. Think of observation as a head-to-toe look at a resident that involves a quick check to see, hear, smell, and feel for any changes. Of all staff, you have the best opportunity to observe residents and monitor both their physical health and emotional status. Record and report any changes you observe. Use of gloves in personal care. As noted earlier in this chapter, infection prevention and control depends on implementing proper techniques as you provide personal care. You should always wear gloves when helping with tasks that involve a resident's body secretions or excretions. This includes assistance with toileting, oral hygiene, bathing, and caring for a resident with skin sores, a rash, or a wound. Wear gloves if you have an open sore, rash, or wound on your hands. Be sensitive to how residents may feel when you put on gloves, and explain that gloves must be worn for certain tasks to protect both them and you from infection. Common preparation and completion steps. Much of your job involves preparation. Preparing in advance for all tasks reduces your workload by helping you get the job done efficiently. All nurse assistant skills involve preparation. Often you will use the same preparation steps every time you do the task. Because residents have different needs and preferences, and because the environment changes, small variations are often necessary. The exact steps of care may differ somewhat from task to task and even from moment to moment. Remember that tasks are not performed the same way for all residents at all times. Quality care involves adjusting tasks to meet the individual's needs. You must be flexible and adapt your care to each resident's preferences. Different equipment and settings may also require adjusting the preparation steps. How you will complete procedures will be similar for most of your daily tasks. Completion steps let the residents know that you're finished with a particular task and also ensure that residents are safe and comfortable. These steps also allow residents the opportunity to ask questions if they need to do so. You can use the phrase "be aware" as an acronym to remind you of the proper preparation steps to include in each task. The word "understand" will remind steps to take when ending each task. Figure 4-10 shows how you can use these words as a reminder of your preparation and completion steps. Table 4-3 provides an overview of common preparation steps, and Table 4-4 provides an overview of common completion steps. Both tables show how the themes of care are incorporated in each step. Become familiar with these preparation and completion steps. Use them daily with all tasks you perform. Note that in some cases, you will need to change the order of some steps because of a resident's specific needs. Bathing. Bathing helps keep skin healthy and prevent skin problems. The three main purposes of bathing are to remove dirt, perspiration, and microorganisms from the skin, increase circulation to the skin, help the resident feel better and more comfortable. If a resident can leave the bed, help with the bath or shower. Facilities have schedules for residents who need help with bathing based on their hygiene needs and comfort. Bathing too often may cause skin dryness, which can cause skin breakdown. Give partial baths between complete baths as needed. A partial bath involves washing only certain body parts. When giving a partial bath, you help residents wash their face, hands, and underarms, and also provide perineal care. Residents who cannot get out of bed need bed baths. Remember, bathing is a very personal activity, and residents may feel uncomfortable receiving assistance. Give them as much privacy as possible during bathing and encourage them to make their own choices about how they bathe. Procedure 4-6 outlines the steps for a tub bath. Procedure 4-7 shows the steps for assisting with a shower. Whirlpool bath. A whirlpool bath is a special therapeutic bath that cleans, helps to relieve pain, and is used as a treatment for a wound that needs daily cleansing or for poor circulation that needs stimulation. Whirlpool baths have jets that move the water in the tub. Some have a mechanical lift for use in getting residents in and out of the tub. Follow the facility's guidelines for using the whirlpool, including cleaning and infection control measures before and after use. Using a resident's personal products. A resident or family member may want you to use certain bath or personal hygiene products for personal care. Honor requests and become familiar with their preferred products such as shower gels, bath oils, or fragrance soaps. Most products come with directions for use. Check the directions and talk with the resident about how they like to use them. Waterless products. Products are available for bathing a resident without water. You may use individually packaged wet cloths or wipes to clean the body without having to rinse or dry the skin. These products can save time. Waterless products such as dry shampoos are also available for hair care. Shampooing. Shampooing can be done in the bed, shower, tub, or sink. Washing the resident's hair once a week is usually enough to keep the hair and scalp clean. Some residents prefer to shampoo more often. Many facilities have a hair salon on the premises or may bring in a hairstylist or barber to give haircuts and style residents' hair. Often you are the one who shampoos the resident's hair, especially those who cannot go to the hair salon. Procedure 4-9 outlines the steps for helping residents with shampooing and conditioning their hair. Oral hygiene. Mouth care helps prevent gum disease and loss. Mouth care also improves a resident's appearance, appetite, sense of well-being, and ability to chew food properly. Mouth and gum problems can be contributing factors to many different diseases. Brushing and flossing. Help a resident brush at least twice a day and floss at least once a day. Flossing stimulates the gums and removes particles of food from between the teeth that brushing cannot remove. Always encourage residents to do these tasks on their own if they can. During mouth care, inspect the gums for any paleness, discoloration, bleeding, sores, or irritation. Inspect the teeth for decay or looseness. Dentures. Dentures, false teeth, are worn by people who have lost some or all of their natural teeth. A resident may have full dentures, both upper and lower, or partial plates that replace some teeth. Partial plates are usually held in place by an attachment to remaining teeth. Dentures and plates are expensive. Handle them carefully to prevent breaking them. Encourage residents to wear their dentures as often as possible to avoid gum shrinkage, help them chew their food, and to improve their speech and appearance. Dentures should be cleaned at least twice daily. When dentures are removed, always store them in a denture cup, in cool water, or a denture cleansing solution if the resident prefers. Mouth care for comatose residents. You may care for residents who are comatose. These residents are not aware of their surroundings and cannot respond. Comatose residents need mouth care every 2 hours. Because they often breathe through their mouth, the mouth and lips become dry. Grooming. Grooming care includes shaving the face, legs, and/or underarms, trimming facial hair, hair care, and care of fingernails and toenails. Shaving. Shaving the face is a daily activity for many male residents. Some female residents may want their underarms and legs shaved during a shower or bath. Male residents can use an electric razor or a safety razor. Never share the same razor among different residents or recap disposable razors. Discard disposable razors in a sharps container. Always check with the charge nurse before shaving a resident to learn if there are any special considerations. For example, residents who are taking blood-thinning medications must use electric razors because their medication could cause too much bleeding if an accidental cut occurs. Facial and other hair. Some female residents have a small amount of facial hair. This is common on the chin, upper lip, and under the lower lip. Never trim or shave this facial hair unless the resident requests it. Always check with the charge nurse before trimming facial hair. Some residents or family members may request hair removal using a cream hair remover, a depilatory. These products contain strong chemicals, so follow the manufacturer's directions for storage and use. A physician's order may be required. Some male residents may have excess hair in the nose or ears that they would like to have trimmed. Use very small safety scissors or a nose hair clipper for this task. Hair care. Hair care includes regular shampooing and conditioning, plus daily brushing, combing, and styling. Daily brushing or combing, along with good nutrition and adequate fluid intake, promotes healthy hair and scalp. Hairstyle is a personal matter. Many facilities offer hair salon services. Make sure to offer these services to your residents. Sometimes preferences in hair care and style are influenced by a resident's ethnic or cultural background. Listen to residents' preferences and honor their requests. Ask the resident or family member about their hair care preferences and hairstyles. Encourage residents to brush and comb their own hair when they are able. Care of fingernails. Fingernail care includes daily cleaning and regular nail trimming. Although the visible part of the nail is not living tissue, the skin around and under it is, and you must protect this area from injury and infection. Trim smooth nails prevent a resident from accidentally scratching and injuring their skin. If residents cannot clean or trim their own fingernails, you can assist with this process. Care of toenails. Toenails are thicker than fingernails, especially in older adults. Foot care is important because older residents are more prone to infection if skin breakdown occurs due to poor circulation in the feet. Foot care includes cleaning and trimming the toenails. A podiatrist, nurse, or physician usually trims toenails. Follow your facility's policy. When you assist with bathing or dressing, inspect residents' feet and between the toes to determine the skin condition. Look for corns, calluses, or other problems. Report any signs of poor circulation, very cold feet, swollen feet, or pale color of the toenail bed, reddened areas, skin breakdown, or cracking of the skin between the toes. Assisting with dressing and undressing. Some residents can dress and undress on their own, while others need your help. Procedure 4-20 outlines the steps for assisting a resident in getting dressed, and Procedure 4-21 outlines the steps for helping with undressing. Preparing for an event. Just as you want to look nice when you have visitors or attend a social event, residents also like to look good for their visitors and special events. If visitors are coming, you may help the resident with grooming and personal care before they arrive. Remove any clutter in the room and bring in extra chairs if needed. If the resident is leaving the facility for an outing, talk with the family in advance. A family member may want to help the resident prepare that day. If not, find out what time the resident needs to be ready and where they are going. Do they need to wear special clothes? If the weather is rainy or cold, be sure they have the right outerwear, including a warm coat, hat, cap, gloves, boots, scarf, etc. Preparing for a big event may be confusing for some residents. Remind them what is going to happen on this occasion, especially if the resident has memory loss. This keeps them from being surprised and gives them something to look forward to. If a resident will be away overnight, prepare an overnight bag with essential items they will need. Make a checklist to be sure you do not forget anything. The extra attention you give a resident in preparing for a visit or outing helps both the resident and the family feel good. They will appreciate your efforts. Points to remember. Infection control principles and personal care skills are a major part of a nurse assistant's job. Microorganisms are tiny organisms that can only be seen with a microscope. They are usually single cells or infectious particles and include bacteria, viruses, fungi, and parasites. The chain of infection is how infectious disease is spread. It begins with a microorganism that is capable of causing disease, pathogen, and includes a reservoir, portal of exit, mode of transmission, portal of entry, and a susceptible host. Standard precautions are practiced designed to prevent the transmission of infectious disease. They represent the minimum infection prevention measures that apply to all patient-resident care in any healthcare setting. Proper hand washing is one of the most important things you can do to prevent the spread of infection. Personal protective equipment is used to prevent the spread of infection. This includes gowns, aprons, gloves, masks, eye shields, and face shields. You must follow your facility's guidelines for handling sharps, soiled linen, regular waste, and hazardous waste to protect residents, other staff, and yourself. Isolation precautions are used to keep microorganisms from spreading from an infected resident to others. You will need to learn the isolation precautions used in your facility. Cleaning is the removal of soil from objects using water, detergent, and scrubbing. Disinfection kills or inhibits the growth of virtually all microorganisms on objects and surfaces using heat, special chemicals, or ultraviolet rays. Sterilization completely eliminates all microorganisms from a surface or object. Personal care includes bathing, mouth care, grooming, and dressing. How much help you provide depends on the unique needs and capabilities of each resident. You must take the time to learn residents' personal preferences and tailor your care accordingly. Observation is essential in providing care. Nurse assistants observe residents to monitor their physical health and emotional status and to ensure that the care provided meets the resident's needs. Be Aware is the acronym that represents common preparation steps in providing personal care, and Understand represents common completion steps. You must learn these steps and make them part of your daily routine.